video in this series, we learned about health equity and the social determinants of health. Here, we'll illustrate which determinants you are likely to encounter in your practice. Socioeconomic status, or SES. Poverty, cash flow, and employment status are probably the most common social determinants you will come across in your work. Operators of food premises or small drinking water systems might not have enough money to replace broken equipment or follow recommended testing protocols. Or maybe a community pool can't pay for needed repairs. Food handler employees may not be able to afford missing shifts when they are sick. Even though people should be exempt from food handling when ill with a communicable disease, there may be other reasons why they don't call in sick. Cultural differences. Our cultural background and previous life experience affects the way we communicate and how we perceive people. Some cultures may not be accustomed to our focus on education and graduated enforcement, or they may not trust an inspector they see as representing the government. Some people may fear the consequences if they ask for help. Many cultural barriers relate to language and literacy. Literacy and education also create barriers for people of any background. Language barriers are an obvious communication challenge for clients or operators, as well as environmental health officers. Low literacy is much harder to see, as many people hesitate to acknowledge their difficulty with reading and writing. Over a third of adults in BC do not have the literacy skills they need to thrive. Immigrants and Aboriginal peoples are even more likely to have low literacy. Without education, people may struggle to follow technical directions or prepare reports in the required format. They will also have a harder time accessing the services they need to be healthy. Psychosocial factors can also create barriers for people. Mental illness, which may be invisible to others, can have a big effect on what people say and do. The everyday stresses and ups and downs of life can also impact behavior. Who doesn't let some details slip sometimes during a crisis? Like having a sick child, going through a divorce, or when a partner loses his or her job. Geographic location can create barriers, especially in remote regions. Living in a small or isolated community presents unique challenges. Getting equipment fixed or replaced can take a long time and be very expensive. People also tend to be more self-sufficient and may rely on local and wild foods that don't come through approved or inspected facilities. We see that health equity and the social determinants of health can affect just about everything you do as an environmental health officer. But isn't all this stuff outside your mandate? Can you really do anything about health inequities? Maybe you can't end poverty or change where people live, but you may find it hard to ignore these factors once you recognize them. It is a tough balance to consider people's barriers while still protecting the public from unsafe food, water, or other hazards. When you recognize social determinants that are hidden behind the scenes, you can acknowledge these and try to find ways to work with or around the barriers and improve compliance. When you can see the big picture, you can encourage other public health staff to see how social determinants create health inequities. Together, we can look for ways to better serve people who face barriers. Maybe you can help people access services they need. When you put all these pieces together, you are better equipped to collaborate with colleagues to respond to the social determinants of health. As we address barriers related to the social determinants of health, we can expect better health for all. Continue watching this video series for more ideas on how health equity relates to your day-to-day work. And search for the Equity and EPH Handbook at www.bccdc.ca.